Hello everyone, my name is Zaire Price, and today I'll be presenting on Louisiana's Project Mom maternal overdose mortality. But before I begin, I want you to imagine a mother who is expecting a child, trying to do everything right. She's going to her appointment, she's preparing for birth, thinking about life after delivery, but behind that hope, there's a silent crisis happening in the background. She's faced with opioid use disorder. If you can't imagine that, here's a short video.
I was pregnant twice and I had used prescription opioids both times. I got addicted very fast. I knew that this was something I had to stop for the sake of my children and for myself. I am more fulfilled today than I ever have been, and I know there's more to come. And brokenness brings us to our healing.
If you are someone you know is struggling, there is hope. Recovery is possible.
What you just saw reflects a reality of what many mothers are facing today. In the United States, accidental overdose is now the leading cause of death among pregnant and postpartum women, which accounts for about 5.2 deaths per 100,000 births. In Louisiana, this has also been the leading cause of pregnancy-associated deaths since 2018. And the impact doesn't just stop with the mother. Approximately one baby is diagnosed with neonatal abstinence syndrome every 24 minutes, which is about 59 newborns every single day entering life already in withdrawals. These conditions can also lead to serious complications like miscarriages, stillbirth, and death, which is what Project Mom focuses on. To understand why Project Mom is actually needed, we have to first start with the problem. And in Louisiana, accidental opioid overdose is now the leading cause of death among pregnant women, accounting for about 34% of pregnancy-related deaths. In 2018, there were 55 pregnancy-associated deaths, and 12 of those were due to accidental overdoses. In 2019, 15 deaths were caused by accidental overdose, and in 2020, there were 82 confirmed pregnancy-associated deaths, and 30 of those were due to accidental overdose. But we also have to understand the gap in care. Pregnant women with opioid use disorder often encounter barriers such as limited access to care, low income, and lack of supportive services. However, the solution is Project Mom, and it is a structured 4-step care model that supports women from the start of pregnancy all the way through 12 months postpartum. And right now, it is only operating at 11 hospitals in the whole state of Louisiana. But with the support from New Start, it has the potential to reach more facilities to reduce preventable maternal deaths and to strengthen outcomes for families across the state. The ultimate purpose of Project Mom is to simply protect mothers, improve infant outcomes, and break the cycle of opioid-related harms. And here's a table showing the trend of maternal overdose deaths, and as you can see, it's continuing to increase. The planned steps of Project Mom first start with screening and assessment. And in this step, a patient can either come through during a routine prenatal visit or when a patient comes into the emergency department. And in these two settings, care is delivered in a trauma-informed and respectful way so that the patients feel safe and supported. After there is a positive opioid use disorder screening, then this leads to connection to treatment. And in this, a provider offers buprenorphine or a different medication for opioid use disorder, and the care team develops a plan for safe care, also prenatal substance use navigators, and when available, other support groups. The third step is maternal and infant care and opioid use disorder treatment, which focuses more on the child and birth. Here, a care team initiates a eat, sleep, console method, which focuses on withdrawal symptoms in newborns, which is due to opioid use disorder. and it ensures a mother has access to medication and naloxone if needed. The last step is postpartum infant care and ongoing recovery. And in this step, there's support to the mother and infant, continuation of treatment, medication treatment, and connection to social and community resources. New Start funding will directly support 3 core areas, which is expanding medication access, care coordination and workforce expansion, and data tracking and program evaluation. Under the first one, this will help to distribute naloxone to prevent overdose deaths. It will also help to distribute buprenorphine to hospitals so that patients will be able to have a better health outcome. Funding will also be used to hire specialized care navigators and to expand Project Mom to other hospitals. Lastly, funds will be used to track maternal overdose deaths and substance use disorder rates before Project Mom, also while during the program to monitor naloxone and buprenorphine distribution and people who are enrolled into the program. And lastly, to analyze changes in overdose death rates over time. What makes Project Mom so different is that it doesn't only focus on medical attention. It also includes behavioral health care and social support. Second, it's grounded in evidence-based practices, which means that the strategies used are proven to actually improve outcomes for both the mothers and the baby. And lastly, hospitals are using universal screening so substance use can be identified early on during pregnancy and postpartum before it leads to more serious complications like down the line. Naloxone is unfortunately not prescribed as much as we need it to be, and data from the CDC shows that only 1 naloxone is given per 70 high-dose opioid prescriptions. In a Massachusetts study, they found that most overdoses occur 7 to 12 months postpartum, often without prior opioid use disorder. In a PA study, it showed that buprenorphine improves outcomes and reduces relapse. And lastly, a West Virginia study showed that women receiving buprenorphine and behavioral health counseling in the Positive Drug-Free Moms and Baby program, there was a decrease in positive drug screenings, as there was 81% in the first trimester for positive drug screenings, which was only 22% at delivery. All of this data shows how Project Mom is grounded in evidence-based practices. The goals of Project Mom are to reduce overdose deaths by 80% within 3 years and protect infants from loss or foster care placement. Second, we want to increase overdose prevention medications such as naloxone and buprenorphine. We also want to reduce the stigma because far too often fear and judgment stop women from seeking the care that they desperately need. But if the stigma is reduced, these patients will actually receive the care and go into it with open arms. Our last goal is to advance coordinated collaboration across healthcare providers, behavioral health, public health, and community partners. The anticipated community benefits are access to medication treatment will reduce overdose deaths, early identification will lead to faster access to treatment, and this will ultimately improve the quality of life. Better coordination of prenatal, postpartum, and substance use treatment will also lead to healthier pregnancies, and it will protect infants from loss or foster care placement. We have 2 major assumptions dealing with Project Mom, and the first one is that healthcare workers at the 11 hospitals will be motivated and educated about the program. Our second assumption is that expanding access to naloxone and buprenorphine and other medications will help to reduce overdose death rates. However, there is some risks that come with Project Mom as well. One is that pregnant women discontinuing treatment after initiation. Patient may experience negative healthcare encounters. There also may be a lack of participation throughout the program. insufficient providers and facilities, and the medication may pose risk to both the mother and the baby. However, all of these risks outweigh the risk of death from overdose. To address these challenges, we will follow up with mothers that are enrolled in Project Mom. We will also provide trauma-informed care training for healthcare staff to make sure that patients aren't experiencing negative healthcare encounters. We'll also raise awareness of services through social media and community outreach to bring up participation. We'll also use the funding from New Start to expand to additional facilities. And we will closely monitor patients and expand telehealth access to decrease the harm of medication to the mother and baby. Thank you guys for listening.